Good evening, all. Parul, we are live. We can start.
Thank you so much, sir. Good evening to our respected dignitaries, esteemed faculty, and students connecting from across the nation and beyond. Myself, Dr. Parul Jindal, along with my colleague, Dr. Nishant Sahai, have this distinct honor to serve as your Master of Ceremony for today's momentous occasion, the virtual inauguration of the ISA National Academic Session 2025-26. The Indian Society of Anesthesiologists National embarks today on a new chapter of learning, collaboration, and academic excellence. In this digital age, we bridge the geographical distances to foster a community of learners dedicated to advancing the field of anesthesiology. Over to you, Nishant.
Thank you, Dr. Parul. And before we begin the session, this is a momentous day today. And before we begin the session, we always invoke the blessings of Ma Saraswati. And let us take the blessings of the revered goddess of knowledge, music, and art, and take a moment of silent reverence to invoke her presence, praying for wisdom and success through this academic session and for the entire session that we have. Just a minute. I'm so sorry. 1 minute, ma'am. So, as is customary, we always begin with the Saraswati Vandana, and the Saraswati Vandana, there is a slight, unfortunately, technical glitch here. I'm so sorry. Yeah. This screen sharing is not allowed, sir. In the meantime,
Nishant, you are the co-host. You can do it.
sir, this is actually, there is a... Sir, can we begin with the session for the moment, sir? May I request the President, Dr. Naveen Malhotra, sir, to start with the flag hosting, please, sir.
Okay, it's my honor and profound pleasure to be here amongst all of you for the inauguration of academic session of Indian Society of Anesthesiologists for the year 2025-2026. And with great honor, I do the digital flag hosting. Thank you. And
Thank you, sir. With this digital flag hosting, which signifies the unity and start of effective endeavors, I now invite Dr. Rajiv Gupta, sir, to deliver his welcome address. Every successful initiative requires meticulous planning and dedicated execution, driven by a dynamic core team. So I now invite our esteemed Secretary of ISA National, Dr. Rajiv Gupta, sir, to formally deliver the welcome address and outline the exciting trajectory of the 2025-26 curriculum. Kindly enlighten us, sir.
Good evening, everyone. I welcome you to this first PG online class of ISA National. Honorable President, sir, Academic Chair, Vice President, sir, all my great teachers, and my friends. It's my privilege and pleasure as a Secretary ISA National to extend a warm and heartfelt welcome to each one of you on this very special occasion, the inauguration of our online postgrad teaching program. Today marks an important milestone in the academic journey of the Indian Society of Anesthesiologists as we move deeper into the era shaped by digital transformation. ISA remains committed to ensure that every postgraduate student in anesthesiology across every corner of our country has access to high quality, uniform, and contemporary education. This initiative is a reflection of that commitment. The aim of this program is not only to strengthen conceptual understanding, but also to provide consistent mentorship, updated knowledge, evidence based practice, and a forum for interactive learning. With participation from some of the most respected academicians and clinicians in our society, we are confident that this platform will enrich the learning experience of every PG student who joins. I'm especially grateful to our esteemed faculty members who have generously offered their time and expertise to guide the next generation of anesthesiologists. Your dedication is what makes a program like this possible. This initiative is desired for the students. We hope you will make the most of this opportunity, engage actively, ask questions, participate in discussions, and allow this platform to support your growth into confident, competent, and compassionate anesthesiologists. I also extend my sincere thanks to the academic committee, the technical team, and all the members of ISC National who work tirelessly behind the scenes to bring this vision to the life. With these words, I warmly welcome you all once again. Let's begin with the fruit of academic journey, one of the strengthens our specialty and inspires excellence. Thank you, and wish you a great successful session.
Thank you, sir. And thank you for those insightful words and very encouraging words that have come from you. And I believe it would not be auspicious if we do not start this academic season and academic sessions without the Saraswati Vandana. So please may I request, let us invoke the blessings of Ma Saraswati. अभी ले लीजिएगा, टेक ओवर, अभी बड़ा में सर को आप बोल दीजिएगा.
Thank you. It is my honor to invite our dynamic president, sir, Dr. Naveen Malhotra, sir, to deliver the inaugural address. Sir, your words always inspire the fraternity. Please, sir, do the honors.
Thank you, Dr. Parul. Respected seniors and dear ISCNs, profound thanks for electing me as your president of ISN National for the year 25-26. We will be following the path which will be guided by the principles of honesty, sincerity, and hard work. And our aim is to work with commitment, competency, and compassion. ISA online PG classes are in being held regularly since last almost 5 years now. And I become a bit nostalgic because way back on 1st July, Doctors Day, we started this class, and it has been one of the flagship online academic program. Students have given the feedback that before going to the exams, they go to the ISA online PG classes, which reflects the effort done by the faculty from all over the country. Without the contribution from the entire fraternity across the country, these classes wouldn't have been so super hit. It was taken to a higher level by Dr. Bajwa, ably supported by Dr. Madhuri Kurdi and other members of the team over the successive years. And being one of my pet projects of ISA, I'm very sure Dr. Rajiv Gupta, Dr. Sethi will always take it to a further level, to much, much higher level. I request the Yuva for which these classes are there, definitely these are attended by seniors also, to please give us constructive feedback also. If you want a particular topic or if you want some changes in the format, we are just a phone call away. Give us a month's time and we will have that topic with the leading authority speaking on that particular topic. I also take this opportunity to thank the moderators who have been there in this journey. I won't be able to name all of them, but definitely a thank you, Dr. Nishant, Dr. Parul, Dr. Swati, Dr. Monica, Dr. Ankur, Dr. Josna, and many, many more. Once again, I congratulate the entire organizing team and also welcome senior past presidents, members of the governing council, chairman academic committee, and as a chancellor, our vice chancellor, Dr. Bala Venkat. This is our commitment to you that whatever is required on the academic field, it will be done focusing on ACR, academics, clinics, and research. Thank you very much. Long live ISA.
Thank you, President Sir, for those inspiring and forward-looking words that has set the tone for this academic year. We all know that the backbone for any academic program is its intellectual leadership. We now turn to the guiding light of our curriculum, the academic chair of the ISA National, Dr. Bala Venkata Subramanian. We invite Sir to share invaluable words of wisdom that will mentor our students as they navigate the complexities of our specialty. Please, Sir, do the honors.
Thank you so much, Dr. Parul Jindal. Respected President, Professor Dr. Naveen Malhotra, President, Indian Society of Anesthesiologists and Chancellor of the College of ISA. Dr. Rajiv Gupta, Honorary Secretary. Dr. Sunil Sethi, the Treasurer, members of the National Governing Council, respected past presidents, and the anchors and moderators of this session over the last few years, Dr. Nishant Sahai and all those who have been involved in making this endeavor a possibility. I'm so happy that we are inaugurating this academic event this evening with that divine blessings of Ma Saraswati. And I'm sure this year-long event will be cherished. And the fruits of it will be borne by every single anesthesiologist who are attending these sessions. Though it is focused mainly for the postgraduates, we know that we learn every day. And I think every single anesthesiologist, immaterial of the number of years of practice, should be a part of this learning session because it gives us immense insights into what is happening in the world today. And it's crucial and important that this session ought to be attended not only by the postgraduates, but every single anesthesiologist across this country, because it's a treasure. And as we all know, knowledge is power. And I think this sessions will inculcate all those insights that are needed to progress effectively in our clinical practice. For all the young students who have joined online, you need to believe that the most important thing for you as a postgraduate student is to be like a dry sponge. A sponge keeps on accumulating water from everywhere, wherever water. So you need to be like that. You need to imbibe. You need to imbibe every single point that comes your way. And this learning platform will be one of the biggest water source for you. Please imbibe, please attend every session. If you're on call, if you're not able to attend, all this will be in the recorded and it will be in the YouTube and in the website. Do spend within this 1 week before the next class comes and try to make it yours. Individual excellence is what makes the difference between a mediocre student and a bright student. It's just not only to pass the exam, the MD, DNP, or DA, but truly it is to pass the exam for life. And the exam for life is every single patient who comes under you should get the best. And for that, you need to upgrade your skills. And individual excellence will convert into institutional excellence, and you will become a brand ambassador of your institution if you're accomplished in knowledge, in skill, and the wisdom to use both. So Indian Society of Anesthesiologists is truly committed to pass on that pearls of wisdom from the teachers to every single postgraduate, immaterial of which part of the country he belongs to, immaterial of the fact that some of them may not have regular classes, but we wanted to bridge the gap and to make the playground similar to every PG across the country. These classes have taken shape. And to start this, we have none other than the president himself. He wants to set the trend. And I'm so happy that today he's going to speak on a very important topic, how to build a career in chronic pain. And I'm sure during his talk, you will realize that there is phenomenal amount of gap that is available. And if you pursue a career in pain, you can soon establish a clinic similar to what Dr. Naveen Malhotra has done himself. And according to each one's belief, pain is the biggest enemy to mankind. And everyone who treats pain are next to angel and next to God. So in this process of becoming an angel and going closer to the Almighty, we have the first session on the various aspects of chronic pain as a career. And I'm sure this year will be yet another year filled with immense knowledge. And on behalf of the Indian Society of Anesthesiologists and on behalf of the College of Indian Society of Anesthesiologists, I welcome all of you who are attending this session and try to imbibe whatever is being discussed today and also try to share this across to all your colleagues so that more and more people will get benefited from these classes. Best wishes, and I'm looking forward that Dr. Naveen will make most of you here as pain physician rather than any other career that you would want to aspire to in anesthesia. Thank you so much for the opportunity and best wishes for the program.
Thank you, sir, for that insightful guidance. Your encouragement will undoubtedly resonate with our young minds. I now invite all of you to join us for a moment of reminiscence and celebration of the journey of all these online classes. Over to you, Dr. Nishant.
Yes, thank you, Dr. Parul. And it has been a momentous journey. It has been a long journey. And this has been a flagship program of the ICA Academics, the ICA Online PG classes, and these all started way back in 2021, the 1st of July 2021, and the then leadership, which was of the ICA, which was led by the honorary secretary, Sir Dr. Naveen Malhotra, sir. It was a flagship program that started in July, and then there were some very reputed speakers that spoke in the first 4 or 5 lectures in that July of 2021. And what we can see is that right from the 1st of July, even till now, the meeting ID and the passcode has remained the same. The ICA online PG classes have gone a long way in these 4.5 years almost. And the first class was started by Dr. Naveen sir, and the timing then was 5 to 6:30 p.m. and again it was on the Mondays, and it was moderated solely by Dr. Naveen sir to begin with.
I request sir to please start his first inaugural ISA online PG classroom teaching on the topic cleft lip and palate.
These classes are held every Monday, sometimes on a Tuesday, but basic sciences, clinical based lectures, and which are not just for the postgraduates, as Bala Venkat sir has already mentioned. There is no age for learning, and these lectures and exam oriented case discussions have come a long way. There are to break the monotony, the faculty also get an opportunity to present these classes. A few MCQs are asked during the sessions, and the audience members are encouraged to tap the answers in the chat box.
So first of all, 3 claps again for the people who are attempting to answer.
You must have a form of remuneration to all these who are answering. Do you have that?
Remuneration is applauses and
one chocolate sent through Amazon gift card or something like that, something exciting which
from the teacher.
So these classes have been going on since 2021. We celebrated 100 classes sometime back, and today is the 205th ICA online class. And this is a source of pride for all of us ICians, because this is probably the largest repository of free anesthesia related educational material by any society in the world, and we should be proud of that. Many people have contributed. The ICL leadership has not only supported these classes, they have very actively participated, and the contributions have been from many sources. The leadership of ISA spanning all the portions of the country. There have been coordinators from different portions of the country, but most importantly, the participants and the faculty from each and every portion, each and every nook and corner of the country have participated and contributed to these classes. There have been classes from the north, the south, the east, and the west.
And this has been an excellent platform also for all the postgraduates. We are able to connect to them all over India. So I think this should keep going, and it is very encouraging for teachers like us also. And I think it's bringing young talent also to this forum. So including it has given me an opportunity to become a better teacher. Thanks a lot.
Definitely.
So from being a good teacher, all these online classes are also available for all the students. These are there on the YouTube channel, and these are actually well received, because even if the students are not able to see these classes live, you can see there have been 38,000 views of some classes, and some very good feedback from the students. They watch this before these exams, all the exams that are going on. So certificates are also given as a form of appreciation to every participant of every class, and this is a flagship initiative of the ISN, Indian Society of Anesthesiologists. Long live ISA and Jai ICN. And now, as we near the conclusion of this inaugural ceremony, it is time to acknowledge the contributions of all those who have worked tirelessly to bring this initiative to fruit. And may I now call upon the vigilant guardian of our resources and a vital pillar of the ISA National Executive, our very own treasurer, Dr. Sunil Sethi sir, to deliver the official vote of thanks. Sunil Sethi sir?
Sir.
Right, sir.
Sir, very good evening to all. And before I deliver my vote of thanks, I will request, we had lost our very senior member from Maulana Azad Medical College. And she is Dr. Kirti N. Saxena, and she was heading the department of MEMC, and she was supposed to retire in this May. May I request all the people present over here to pay homage and obituary to her. We will keep a silence of 1 minute. Thank you. It's my privilege to be here and to say vote of thanks for the ISA National this time. And it's a great thing to see most of the academicians, past president sir, and all the governing council members and the learned faculty from pan India. Even I can see the past presidents attending this. I must congratulate Dr. Naveen Malhotra for starting this PG online classes long back, and the things were continued in the tenure of Dr. Bajwa as well, and now as Dr. Naveen has taken as president, and it was very nice to have Dr. Bala Venkat. I must thank him for continuing these PG classes, and we have achieved a new height during this period, and this will continue, and this will enrich our knowledge. I must thank the whole governing council members for guiding us during this period. And I must thank all the speakers and national faculty, those who are being part of this. And most important is the coordinators and the PG students, those who are present and asking the questions. This enriches our knowledge. And I may not be very right if I am not thanking all those media people and the supportive team which are conducting these events flawlessly. Thank you very much.
Thank you so much, sir, for such kind words. We wish all the participating postgraduate students a highly enriching, challenging, and successful academic year. May you absorb the knowledge, ask critical questions, and develop into exceptional anesthetists and pain physicians. As we formally inaugurate the session, we transition immediately into the core of our academic pursuit. The first module of this prestigious online class series is dedicated to a field of critical importance and evolving challenges in clinical practice, pain medicine, a career that matters, the art and science of healing pain. Chronic pain is complex, multidimensional issue affecting millions, demanding a holistic and empathetic approach from pain physicians. Today's introductory session aims to lay the groundwork, defining the scope, challenges, and contemporary strategies in managing persistent pain states. This topic sets a high standard for the depth of knowledge we aim to cover throughout this academic session. May I request Nishant to please invite our esteemed speaker today?
Thank you, Dr. Parul. And it is an absolute honor and pleasure to be able to introduce our own president, Dr. Naveen Malhotra, sir. Sir, per se, does not need much of introduction. He has been a senior professor. He's a senior professor and director at the AS Pain Management Center at Rohtak, a former head and pain management center, uh, Postgraduate Institute of Medical Sciences, Rohtak. He has more than 240 publications, more than 500 presentations. He's the national president of ISA, the national president of the Research Society of Anesthesiology and Clinical Pharmacology, the national vice president of the Indian Society of Study of Pain, the honorary secretary, our honorary secretary, ISA National from 2018 to 2022, the honorary secretary of the SARC AA, and the deputy chair of the Asian Australasian Regional Section of WFSA. A very warm welcome, sir, and over to you, sir. Can you?
Thank you, Nishant, for the kind introduction. Why I chose this topic? Yes, I am a pain physician, and pain medicine is very close to my heart. The main aim is to ensure that more and more anesthesiologists in the country take up chronic pain exclusively as a career option. And for that, we have to nurture pain medicine as a specialty, super specialty of anesthesia. We have to have the support of Department of Anesthesia in building pain medicine by ensuring that there are functional pain clinics across the country in all the medical colleges. Pain clinics are mandatory as per NMC, but at times some of them are not fully functional. And by fully functional, I mean that there should be dedicated team which is sitting in the pain clinics performing both fluoroangiography guided minimally invasive pain and spine interventions, the MIPSIs. And for that, you have to spare some dedicated faculty to go for training and come back and teach the postgraduate students. It is not putting the needles only. As per the available data across the world, 70 to 80% of the patients are managed conservatively. But when required, the minimally invasive pain and spine interventions, they should not be delayed, and ultimate aim is to benefit the mankind for which we are meant. First, we are doctors, then we are president or secretary, whatever you may call. It is rightly said that with wisdom and patience, we overcome hurdles. His teachings lights the path, guiding us forward. So I invoke the blessings of Lord Ganesha to shower wisdom and knowledge on all of us. I shall be speaking on pain medicine, a career that matters. I bring with myself greetings from APMC, AS Pain Management Center, where we are working in a team along with my co-consultants, Dr. Amit and Dr. Neha. And herein, I want to highlight this thing also. We should always work in a team. That not only excels us into the clinics, academics, and research, but also it helps us in sustaining the work-life balance. And we are all working in a team. My wife, being a gynecologist, runs an IVF center there. Now, the first question comes to everybody's minds is how to become a pain physician. We have to undergo training, teaching, build an infrastructure, invest some money, how the patients will come, how alone I will do the procedures. There are so many obstacles. You may feel so. But if you are positive, you will see opportunities instead of obstacles. Around 20% of Indian population is suffering from chronic pain at any given point of time. And 20% means that with a population of around 145 CR, roughly 30 crore people are suffering from pain. And majority of them are suffering from musculoskeletal pain, the other important causes being neuropathic pain and cancer pain. For this 145 crore population, the official data is that there are roughly only 5,000 qualified pain physicians, meaning thereby there is a big gap between patients who are, most of them are untreated. Even the clinicians also don't know where to refer the patient. And patients also don't know which doctor to consult. The reality is that India needs lakhs and lakhs of pain physicians, and it is very essential to develop pain medicine as a super specialty of our mother branch, anesthesiologists. It is rightly said, if you do not do it, somebody else will do it. If it has to be done, it should be done. So we should not let pain medicine slip out of anesthesiology. It should remain, the anesthesiology should remain mother of pain medicine. And being an anesthesiologist, I personally feel that we are naturally inclined towards becoming pain physicians. Why? Because our role as a pain physician is a natural extension of our professional work, which we do day in and day out. We have to take the lead because we are well versed with art and science of treating pain. And dear friends, the future belongs to those who prepare for it. So we have to prepare anesthesiologists who take up pain medicine exclusively as a career and become successful pain physicians. A very important implication for anesthesiologists is that sometimes we feel that we are behind the scene and do not get due recognition by the patients and the society. This notion has changed over the decades, especially after COVID pandemic, but more steps are needed. However, once you become a pain physician, this itself is taken care because you are in direct touch with the patients, you are in direct touch with the society, patients and their relatives, they come to you in your OPD. Right now I am sitting in my OPD and delivering the talk. As a pain physician, our aim is to improve the quality of life of the patient by rendering him or her pain free. We should not treat the pain but the cause of pain. Whether it requires pharmacotherapy or MIPSIs, that is your choice. But ultimate aim is to treat the patient and improve the quality of life. For building a career in pain medicine, you should have a keen interest in it. And the most important aspect is to be a very good listener. At times, when we are sitting in our pain center, patients after sixth or seventh minute will tell the actual thing. As an anesthesiologist, our interaction with the patients is primarily in the PSCs and during the counseling sessions in the critical care, and we tell the specified things. But in pain medicine, you have to listen, listen, and listen. However, on a lighter side, as an anesthesiologist, when we are working in the OT, somebody makes a noise, okay, give some more midazolam. Somebody is uncomfortable, give dexmedetomidine. Okay, give some propofol. Pain is there, give fentanyl. So we sedate them, we anesthetize them, and we make them pain free. But in pain medicine, you have to listen, you have to understand their pain, be compassionate, and have infinite patience of listening to the patients. Now, how to decide that I want to become a pain physician or I'm not interested in cardiac, neuropediatric, critical care? For that, you have to talk to yourself. Look into the mirror. Look into your eyes. You will find the answer. Or I tell you a secret, what I do, I sit in the temple. Whichever ideas come at that mind, whichever ideas come to my mind when I'm sitting in the temple, I think that these are the blessings of God and they have to be implemented. In every house, there is a worship area. Because once you choose a field you love, you will never ever have to work a single day in your life. You will be simply flowing with time and enjoying your work. Once you come back home after seeing a heavy OPD, the glow on your face will be there. Your family will think that you're as fresh after the bath when you went to the hospital and you're coming after 12 hours because that hormonal changes, that emotional gratification will be reflecting on your face, in your actions and your words. Life presents many choices. The choices we make determine our future. So we have to make the choice very, very wisely. And you should be ready for a new chapter in your life by becoming a super specialist in the field of pain medicine. Unfortunately, whatever is the status of anesthesia education during medical schooling in MBBS, almost same is the status of pain education during anesthesia post graduation. In the competency based curriculum by the NMC, there are almost 2 pages dedicated to pain. But still, its implementation at the medical colleges is lacking in letter and spirit. That is why I take this opportunity to humbly request all the HODs of different departments across the country to ensure that there is a functional pain clinic in each medical college and there is a single or more faculty dedicated to chronic pain who has undergone adequate teaching and training so that the same can be imparted to the postgraduate students of your institute. So the best way to get something done is to begin. If it has not been done, don't worry. We have to begin someday. And never stop learning because life never stops teaching. I have seen people starting a career in pain medicine in their 50s. So, because they decided and they simply did it. Now, for building a career in pain medicine, for increasing the number of pain physicians across the country, there are many opportunities. DM Pain Medicine. It is right now functional in AIMS Rishikesh, AIMS Gorakhpur, and AIMS Mangalagiri. Recently, the counseling has been done for the INI exam, and I'm very happy to share that for the number of seats, around six of them, 40 have qualified. So that shows a keen interest in the field of pain medicine. ISA, along with Indian Society for Study of Pain, has been liaising with NMC for starting DM pain medicine in the medical colleges also. And I'm happy to share with you that it is in the final stages. Our request is that the feeder specialty should be anesthesiology only. And I'm very sure in the coming year it will be notified by in the Gazette of India. FNB pain medicine. It is a 2 years dedicated course by National Board of Examination in Medical Sciences, exclusively for anesthesiologists. Entrance exam known as FET, Fellowship Entrance Test, and exit exam is there. It is running right now in Delhi, Calcutta, Chennai, UP, West Bengal. And personally, I'm happy to share with you that when I was the chairperson of the PG Board of Studies in Anesthesiology at National Board, we could get this course notified and started. Even the curriculum was handwritten by me personally, and it has got essential and desirable criteria so that it can be easily implemented across the country. And initially there were some hiccups, so I'm happy to share now this course can be started in 10 bedded hospitals also. The essentiality of 100 bedded hospital has been waived off. Then there are PDF courses, postdoctoral fellowship courses of 1 year and 2 year run by different universities, SGPGI, BHU, Maharashtra University of Health Sciences, DY Patil, and others in RML, PGI, AIMS. Many times students ask me, sir, which one of them is the NMC recognized? As of now, DM pain medicine and FNB pain medicine are the only two courses which are recognized as an additional qualifications by NMC. The PDF courses get a university recognition. But if we go by the number of seats in DM, FNB, PDF courses, the number is less as of now. We are working to increase that. In addition to that, we have got a very successful program of Fellowship of Indian Academy of Pain Medicine by Indian Society for Study of Pain, which also has got an entrance exam and an exit exam. This year's exit exam is on 4th January. It is a 1 year dedicated course where you go across the more than 26 centers across the country. And yes, APMC is also one of the centers where we have a fellow for 1 year, where the stipend is paid monthly, and it is an in-house fellowship where the fellow comes to the center for 1 year. Then there are numerous courses run by senior pain physicians from whom we have also learned when there were no DM and FNB running in different parts of the country: Delhi, West Bengal, Maharashtra, Telangana, which are of variable durations, both online and on site. I'm happy to share that APMC is also shouldering this responsibility of education, teaching, and training by doing fellowship in pain medicine, both online and on-site and hybrid mode. We never wanted to start the online fellowship, but the request came from the lady anesthesiologists and who form 60% of the members of the ISA, because at times it is difficult to leave the home for a long period of time because kids are small, lactation is going on, or we are antenatal. So at least we can use this time to prime our knowledge by the online mode. And then they come for on-site fellowship where they are taught and trained how to examine the patient in the OPD, how to talk to the patient, how to interpret the investigations, and then how to perform the MIPSIs. It's not only interventions. I always say patients don't come in OT, they come in pain center, in pain clinic. So you have to know how to talk to the patient, how to convince him for the blocks, which MIPSI has to be done, how to interpret an MRI, CT scan, X-ray pertaining to the field of pain medicine. And ultimate aim for all the senior pain physicians is that we want anesthesiologists who work exclusively in the field of pain medicine. These are the pictures of some of the fellows who have come to us of varying age. And yes, majority of them are ladies also. Do not compare yourself to others. Be like sun and moon and shine when it is your time. And make 2025 as your year and ensure that whatever you decide in 2025 is implemented and achieved in 2026. We should complete the training as early as possible, and it is advised to the youngsters, preferably within 1 to 2 years of senior residency. Especially for the ladies, marriage, pregnancy. I understand that I am a gentleman, but still I feel ladies have to work more at home. It is easy for us to leave home, but once a lady plans to leave home, she has to plan so many things about the diet, about the kid, about the grandparents, and also about the husband. So many things planning has to be done. So please complete your training as early as possible. For private practitioners, it is difficult to leave practice because if you go for training, you lose money and you lose practice also. The answer for that is simple: group practice. If you are in group practice, then you can excel and advance your knowledge and skills by going to attend these fellowships. And those who are working in government setup, it is difficult at times to get on duty leave. We have to manage all these things and ensure that there is a work-life balance and we excel both at home and in the profession. And during this training, as I was discussing, the foundation is on history examination, investigations, interpretations of radiological investigations, and performing minimally invasive pain and spine interventions. And you are exposed to the multimodal approach to the pain management, including pharmacotherapy, minimally invasive pain and spine interventions, psychological counseling, and physiotherapy. Once you have done the fellowship, teaching and training, you come back to your setup. If you're in a government setup, I was also HOD. So what is your expectations? Can do anesthesia also, and you are bubbling with knowledge and skills, and you want to work in pain. But for that, you should find that at least there are two OPD days for you in a week. Tuesdays and Fridays, I used to have dedicated OT days, Thursday, where you can do the procedures without worrying about the intubation and the extubation and about performing the epidurals and brachial plexus block. And dear friends, OPD never runs in pre-medication room or outside the OT. OPD runs where the orthopedics, gynae, medicine OPD is there. So you need to have an OPD space in the main OPD complex. It is very difficult for the patients to reach to the OT otherwise also. OTs are usually in such area where patients cannot, the traffic is less. And then you need to have a support staff also, and you need juniors also. This is the minimum mandatory set of equipments which should be there in the pain clinics and the pain centers. Everybody invests. A radiologist, an orthopedician, a surgeon, when they start, gynecologist, when they start their hospital, they invest. Then why should we worry about investing? If it is our own center, a fluoroscope, which costs somewhere around 12 to 18 lakhs, ultrasound machine, same price, 12 to 18 lakhs, radiofrequency machine, anything from 14 to 35 lakhs, a PRP machine around quarter to 2.75 lakhs, nerve stimulator around 50,000. But no need to invest directly at one time. PRP, very less investment, around 3 lakhs. Radiofrequency, you can do it after 6 months to 1 year once you build your pain practice. USG, if there is a USG in your department, then absolutely no issues. You can get a PCPNET license in your name. And fluoroscope, you can use in a hospital where already orthopedics or urology OT is functioning. So you can use that fluoroscope. But these are the equipments which are required in a functional pain center. Coming to those who are working in private practice, after training, initially, yes, you may have to do some bit of anesthesia and some bit of pain medicine, but fix your hours. That between these hours and these days, in your hospital where you are working, it should be written that Dr. ABC is available between 4 to 6 p.m. on Mondays, Wednesdays, and Fridays, and these are the services that are being looked after or catered to them by them. You can use the OT and the fluoroscope. Simple rule is whatever is the patient bill, 30% goes to the hospital and 70% comes to you. Minimum is 20, maximum is 40%. You share with the revenue with the hospital. So that will help you in cutting the cost, where you can use the autoclaved linen, the betadine spirit, the OT table, the fluoroscope, and the OT technician help also is there. You have to build a profitable pain practice. And by profit, I don't only mean remuneration. Yes, that is also important, but it should be pertaining to your professional satisfaction, academics, research, work life balance, and also money. Money is important, no doubt about that. So, our first pillar is clinical excellence. Undergo adequate teaching and training. It takes 1 year to become a pain physician. You will have to undergo that journey of 1 year by different means of fellowships, online, on-site, off-site, dedicated programs, workshops, reading, self-reading, and once you're seeing patients, self-learning, talking to your seniors where you undergo teaching and training, so that you can have strong clinical outcomes. Then patient experience should be comfortable. There should be short wait times. Please do not do, I am in the OT, when patient comes, call me to the OPD. No. This never happens. It is the rule of universe that if you sit in the OPD, patients will come. Suppose I start my day at 9:30, someday I come at 10 o'clock, there will be no patients. But once I reach, there is flurry of patients within few minutes. So you have to sit for a dedicated time, dedicated days in the OPD and ensure there is continuity of care to the patients. It's not like that today you are sitting, some next day you are not available and there is nobody to follow it up. If you are not available, your substitute should be there and there should be clear communication with the patients. Build a team and build the infrastructure. Be entrepreneur. In addition to the pain physicians, we need hospital staff also who can talk to the patients, who can guide. My golden advice to you is let the financial packages be discussed by the reception staff. Do not talk to the patient that this MIPS is going to cost this much. No, you are a doctor, you deal only with the clinical aspects. Let finances be handled by the reception staff. And definitely have good technology investment so that you've got latest gadgets and latest equipments. A good fluoroscope will help you perform the MIPSs in the best possible manner. A good USG machine will locate, okay, needle is going in the right direction and there is a good spread of the drug at the affected site. Build a pain team. There is no substitute to that. Whatever I am speaking today is not only my work. It is the work of the pain team which works with me with this smile. Even if we have finished the OT at 11:45 p.m., the smile is there because we are getting a kick by rendering the patients pain-free. Nowadays, it is important to do a proper marketing strategy. By having a referral network, do not pay cuts to anybody. But the community physician should know where to refer the patient. You should be present digitally on the websites, the patient testimonials, Instagram, Facebook, LinkedIn, everywhere. Do some camps also. Do some charity work also for the Rotary, for the Manav Seva Sanghs, and so forth. And ensure that each and every patient is looked after very well. Do not worry about the referrals. India is not short of patients. As I told you, 30 crore people suffering from chronic pain at any given point of time and only 5,000 pain physicians. However, based on our experience, there is a certain set of referrals. Initially, the orthopedicians and neurosurgeons will send their selected bad patients to you who have become their headache. Then general referrals will come, and most important is patient referral. Those patients whom you have treated, they will send more patients. 80% of the referral will become the patient referral. Then the surgeons start getting themselves treated, and finally, your own colleagues refer the patients to you, get their relatives treated by you, and themselves treated by you. Ensure that the quality and compliances are maintained. Go for accreditation of NABH so that TPAs are there, and because nowadays patients want cashless treatment. Do regular audits. Medical legal safeguards, I'll touch that upon also. 3 medical legal safeguards are important. One is if you're using a fluoroscope, you should have an AERB license, Atomic Energy Regulatory Board license, PCP Unity license if you're using a USG machine. All the licenses required for NABH. Please do not worry as an anesthesiologist, you can have PCP Unity license in your name. We had, when I was institute in anesthesia, we had in our name affidavit of all the consultants. When I moved to cardiac anesthesia and pain, anesthesia name related, the name in the TE and for the pain clinic, the name was changed. When I have my own center, now we got 2 ultrasound machines with Dr. Rakhi, Dr. Naveen Malhotra, Dr. Amit, and Dr. Neha's name there. So as an anesthesiologist, you can have a PCPND license your name. You need not go any extra training. You simply have to follow the procedure, submit an affidavit that you're not going to do sex testing, sex determination. You're not going to run it as in a diagnostic radiological lab like other radiologists are doing. You are simply going to use it for aid in performing the nerve blocks and the vascular access. And once you do not compromise on quality, that enhances your credibility. So take care other of the radiation exposure also by having lead free or lead 0.5 thickness. 0.25 is light, but uh, use 0.5, use thyroid guard also, and do adequate protection. Nowadays, even head is available and goggles are available. Have a TLD which can measure how much radiation exposure is being done so that you are in a safe limit, and do take professional indemnity at least of 1 CR. It is mandatory for all anesthesiologists. I'm not going to promote any indemnity here, but ISA has a tie-up with ICICI through CoverU, and it has been running successfully since last 6 years or so. But please take professional indemnity of at least 1 CR and do ethical practice. Avoid unnecessary interventions. If a patient has been treated by some of your colleagues, a MIPSI has been performed and it has not given the desired result, or a surgeon has done surgery and pain is still persisting, and you perform the MIPSI and patient gets relieved. So your simple answer should be, it's God's kindness that it was through my hands that I was destined to treat you. I always say every doctor wants that his patient should be cured. So they have tried their best, we are trying our best. This line I always say to all my patients, and always support your colleagues. Do not say anything foul about them or their actions. Another pillar of a foundations, which form the foundations of a profitable practice, is that there should be a operational efficiency, streamlined workflow, and obviously reduced no-show, that you are not available when patient is there. And do not compromise on the pharmacotherapy. You should be very reasonable in prescribing them, but follow the evidence-based. Quality and cost both have to be maintained, and monitor safety and side effects. And financial management is definitely uh, important, because without finances, nothing runs. So you have to optimize the billing, estimate your expenses, you have to diversify the referral sources and control the costs. And if you ask me a number, within 1 year of your practice, you can add any number of zeros after one if you're working exclusively as a pain physician. And then you should know when to expand. Expansion can be in the form of having another fluoroscope, having your own X-ray machine, having endoscopy suite. So you can expand. Always invest something for expansion also. So for a profitable pain clinic, it should be based on a model that is sustainable, on the strong pillars of clinical excellence, guided by ethical growth, and investing some of the income which you are getting. Then it will be really a profitable pain clinic. Dear friends, I summarize by saying that chronic pain might be a new epidemic if not dealt cautiously. And the backbone of pain medicine is the pain physician. You have to work with the patients, make them pain free, and smile, and keep on smiling yourself also. Just to show how much work you can do. This is one of the OT list. You must have seen the OT list of the surgeons, but this is pain OT list, pain management center, my name and the name of my consultants have your this much work you can do. 62 patients, 86 blocks in a single day, and all types of blocks. The list ran into 4 pages. By showing so, I want to say that if you start working, there is no dearth of patients. And the credit is not only to me, but the entire pain team, which has been working over the last 20 years with me, both boys and girls, smilingly. This is a picture, I look bit younger this is a picture of 2015, right? So the team has been working with me day in and day out. The credit goes to them also. Please take time after teaching and training to regularly attend the hands-on workshop. These are the pictures of the recently conducted hands-on workshop on MIPSI at ISACON 2025 Raipur, where we work with our young budding anesthesiologists who wish to build their career in pain medicine. It was both cadaveric hands-on fluoroscope guided and USG scanning on volunteers. And we had faculty, Dr. Carolina Halock Lurs, the president-elect of World Federation for Society of Anesthesiologists. She was also invited faculty, and she is also a dedicated pain physician who works in her pain center, and she was enthusiastic in teaching the students from morning to evening throughout the day. And all the faculty which participated, because with faculty, it's not only my work, it's the team work. And this is the other pain workshop. This was a live workshop we did at ISOCON 2023 Gurugram, which was held. The pain workshop was done at PGI Rohtak, my ex-institute, and where faculty, the past president, Dr. Muralidhar Joshi, and other senior faculty members were there. It was a live workshop on interventional pain management and then hands-on on cadavers. So to summarize, once you become a pain physician, you become self-dependent. Absolutely no dependence on the surgeon. You get immense clinical satisfaction, very good financial returns. You can do lots of teaching, training, and research. You get social recognition. You get few emergencies. You're celebrating your son's birthday and a cesarean call comes. Nothing in. There are really very, very rare acute emergencies in chronic pain, so that you can have a good work-life balance also. And above all, you get tons and tons and tons and tons of blessings of the patients, which remove all the hurdles in your life and all your dreams come true. One such blessings given by patients, you are pious as the name of God. You are the journey to our destination. How will we forget you, dear doctor? You are just like breaths for us. You get to see all strata of patients, from a rickshawala to a chief minister, from a very poor who cannot afford the MIPSI, you have to do it free of cost, to a billionaire who wants take anything but relieve my pain. You can do basic to advanced interventions, a simple intra-articular injection of the knee joint or a trigger point injection, to advanced interventions like endoscopic procedures. You can do immediate interventions. Patient is in severe pain, pain score 10 by 10. Intervention has to be done on the day one itself. Or an old lady who wants to, where you can give 4 to 6 weeks of conservative treatment, and then you can plan the intervention. There are lots and lots of avenues of clinical exposure, teaching and training, research, and you can establish pain medicine as a super specialty. I always conclude my talk. This is a Dai Handi festival where this matki of pain has to be broken. And this matki of pain can be broken on the foundations of a detailed history taking, proper examination, relevant investigations, and timely interventions. Then only this matki of pain will be broken if we follow this holistic approach. Dear friends, there are three mantras in life. If you follow them, you are bound to be successful: honesty, sincerity, and hard work. If your intent is good, the results will definitely be good. You are what you believe in. You become that which you believe you can become. So please believe that I will become pain physician. Say after me today, unmute yourself and say, I want to become a pain physician.
I want to become a pain physician.
Yes.
I want to become a pain physician.
I want to be a pain physician.
I want to be a pain physician.
I want to be a pain
I
physician.
want to be a
Yeah,
pain
I want to
physician.
become a pain physician.
I want to become a pain physician.
I want to be a pain physician.
I want to become a pain physician.
I'm already a pain physician.
Right, sir. You are my teacher, sir. So for those who wish to start their career in pain medicine, one day I will become pain physician. No. Day one, 8th December 2025, ISA National Online PG classes. You decide that you want to build your career in pain medicine and you want to become pain physician, because magic is believing in yourself. If you can make that happen, you can make anything happen. And I conclude my talk by saying, सामने हो मंजिल तो रास्ता न मोड़ना, जो मन में हो ख्वाब उसे मत तोड़ना. सामने हो मंजिल तो रास्ता न मोड़ना, जो मन में हो ख्वाब उसे मत तोड़ना. हर कदम पे कामयाबी मिलेगी तुम्हें. ए आईसीएन, हर कदम पे मिलेगी कामयाबी तुम्हें. बस सितारों को छूने के लिए कभी जमीन को ना छोड़ना, कभी जमीन को ना छोड़ना. Thank you very much.
Excellent talk, sir. Hearty congratulations.
Thank you, sir, for sharing your valuable insights and expertise with us today. The chat box is filled with compliments, the best wishes for your tenure, and there are a lot of queries. One is Dr. Ruchi has asked you that are you admitting the patients on on OPD basis, or you admit them and then perform the procedures?
Majority of the procedures are on daycare basis. The patient comes in the morning. Usually, we follow the principle of doing the interventions. If not emergency, we do not do it after sunset. But if it is emergency, we can do it after that also. And patient comes with a light breakfast. We ask them to relax for 15-20 minutes, check the vitals, and few investigations if it has to be done, like complete hemogram, blood sugar, they are done. We perform the procedure. Then in the recovery room, we observe them for around half an hour to 45 minutes. Then see how much is the pain relief, give the post-procedure instructions. So usually patient goes back home. Patients ask me, okay, sir, kuch bed rest to nahi karna padega or like that. So we say you will come walking, go walking. One. For those who are under TPAs, which require 24 hours admission, then we have to admit them and discharge them the next day, because that is mandatory for them to be shown 24-hour admission. But majority of the procedures are done on the daycare. Patient can come on the same day and go back the same day.
Thank you, sir. Over to you, Nishant.
Yes, an extremely motivating and encouraging talk, sir. The chat box itself is filled with a lot of compliments. And for the young person who wants to become, a lot of people have said they might want to become a pain physician. Sir, if somebody is doing a DM in pain medicine, for admission as a faculty into a medical college, will that experience be counted as an anesthesiology experience also? What is the update on that, sir?
See, first of all, there is absolutely his experience will be counted for a faculty recruitment. One. Two, after joining, he will like to do pain medicine. Once you have done DM, you will not like to go and conduct cesarean sections or hysterectomies or fracture femur. So it is imperative upon the institutes who recruit such DM fellows to give them liberty to build the field of pain medicine in corporate sector as well as in private medical colleges and in freelance practice, standalone pain centers. That is not an issue. Private medical colleges you will join only if you are given this freedom. Otherwise, you won't join. Corporate, you join as a pain physician only, and if your own center, absolutely no issues. But in government setup, you can become a faculty in anesthesia, and liberty should be given to practice pain medicine.
So there's a question by Dr. Shreya. She asks you, do pain medicine doctors work along with the oncologist for the treatment of cancer-induced pain?
See, when we talk of chronic pain, it will take care of the musculoskeletal pain also, the neuropathic pain also, and the cancer pain also, right? So, oncology patient usually they refer the patients to us for management of the pain. They will be taking care. Their aspect is either they go for the surgical. Somebody is oncosurgeon, he will do the surgery, and somebody who is a medical oncologist will take care of the chemotherapy, and other people, other will take care of the radiotherapy. But when it comes to the pain medicine, yes, we discuss, interact upon each other. What are the expectations from each other? But as far as the field of managing pain is there, it is done by the pain physicians only in the pain centers. Sometimes we feel that there is a bony metastasis in the vertebra. We'll take the help of the radiotherapy people to go for the focused radiotherapy, right? Sometimes the mass is compressing upon the nerve. The surgeon will take care. So at the end of the day, it is a teamwork where the role of everyone is specified. As a pain physician, oncologist cannot do interventions, right? Oncologist may not be that well versed in titrating the dose of the morphine or the patches, buprenorphine and fentanyl patches. So that is your forte, which you have to take care of that. The pharmacotherapy pertaining to chronic pain, the use of multimodal regime, maybe gabapentins or the opioids or the anti-inflammatory drugs, along with interventions. Whether it is celiac plexus block for cancer pain management, or it is a splanchnic nerve block, or it is a glossopharyngeal nerve block, superior hypogastric plexus block, all these fall under the domain of the persons, pain physicians who perform these MIPSs.
Thank you, sir. Nishant?
Yes, sir. Do these pain, suppose somebody establishes a pain clinic, will they be able to dispense the opioids? Is there any specific rules and guidelines for that?
See, if you want to dispense opioids, you need to have a narcotic license. You have to apply for a narcotic license for which the medical superintendent of your hospital and the anesthesiologist, they have to give an affidavit that the proper this much is the consumption, proposed consumption for the year, and this much is the record keeping will be the register is maintained where record is maintained. Now I take three scenarios. One is a stand-alone pain center like I am there, and I want to dispense opioids. So you need to first have a pharmacy. If you got a pharmacy, then you can dispense. You can have the billing of patches. Buprenorphine patch, you can keep it yourself. Biscane, cannabis drops, you can keep it with yourself and you can dispense. But now, if you don't have a narcotic license, there is a specified form which you have to fill, the name of the patient, the diagnosis, which opioid is required, like 100 milligrams of 100 tablets of 20 milligrams morphine tablet, or patches of fentanyl, 3 patches, sign stamp. You can give it to the patient and they can buy it from the authorized distributors across the different states. There, in each state there are at least 5, 6 in different districts, so they can go there. If you're working in a medical college, then you need to have a narcotic license, and then you can have fentanyl, pethidine, morphine patches in your pain clinic where inventory is made in the register. Same is true for the corporate setup.
Right, sir. There are a lot of senior people in the audience, sir. Maybe allow them to unmute themselves and interact.
Please go ahead. Like
Before that, we have a
this
question for
is
you, sir.
this is. I'll just remove my background. I'll just a minute. Uh, So this is the form which is there. It says Form 26, and it is particular to this state. If you can, so this is the form where it is written, prescription of medical practitioner not to be repeated as per Haryana NDPS Act, name and address of the person prescribing, nature of disease, directions for use, description of the drug. So I'll write mine, name of the patient and what is the diagnosis. I'll write my name also, directions for use, which drug, like fentanyl injection, morphine injection, fentanyl patch, morphine tablet, even your pethidine is also mentioned, and remifentanil is also mentioned. Quantity of drug to be issued, your name, stamp, everything, and address of the hospital. So you can just simply fill this form and they can get it. And even you can, the name and address of the stockist is also written.
Sir, there's one more question for you. Can we start some basic certified courses for nursing staff who are working in wards and ICU and casualty areas?
Now, this is not pertaining to pain medicine, and but in different universities, there are training courses which are going on, especially training them to work in ICU. But my humble request is treat them for your own ICUs. You train them and they're taken by others. That should not happen. And these can be, as far as ISA is concerned, if such a proposal comes, we will definitely look into it and we can do that. Certification can be done at the level of ISA. Dr. Rajiv can look into that, and definitely we can have a dedicated course under the proposed fellowships which are coming up in the Center of Excellences across the country. So, I'm happy to share with all of you that in the new year we will be ready with our second dream project. Why these online PG classes started? Uniform teaching across the country. Other dream project is uniform training across the country. You can have the teaching, this thing, but training can be physical. So we are planning to establish center of excellences across the country where ISA members come to your place, maybe as short as a weekend and as long as 6 months to 1 year. Whatever is your forte. If you're good in pain, you develop the module for that. If you're good in critical care, develop the module for that. If you're good in pediatric anesthesia, if you're good in simply one particular aspect, fiber optic bronchoscopy, right, or percutaneous tracheostomy, anything which you think that yes, this is my forte, then spread your knowledge and pass on your legacy to the youngsters so that they can take it forward. And definitely it will be not on a charitable basis. We'll work out a financial model also so that it is economical for the members as well it is sustainable for the centers who run it. I hope I have answered that question.
Yes, sir. Thank you so much, sir. Dr. Nishant?
Yes, ma'am. What we can do is we can just request many of the senior persons I can see in the audience, if they wish to interact directly, they can unmute themselves and interact here.
If there are any comments or some queries or questions, they are most welcome. So,
most of the
Naveen sir, good evening.
Good evening, Dr. Hina. Good evening.
Yes, sir. Sir, the many of the PGs, they have joined your classes, sir, after their MD, and they are very happy. And two girls, they have started their pain practice also, sir.
Yeah. Thank you for that one. And I keep in touch with the fellows, and that encourages us to go and
Yes.
ensuring that we keep on producing more number of pain physicians and they do ethical
Yes,
and
sir.
safe practice.
Sir, regarding this the nursing basic course, na sir, one of the our NABH assessor, they have asked the nursing staff that whether they have taken the training or not, something like that.
It is important from NABH purposes. And,
Yes, sir.
And but that point is noted. We'll work on that. Thank you, Dr.
Okay, sir. Thank you, sir. Thank you, sir.
And Dr. Rajiv, Dr. Sethi, Dr. Nishant, and Parul, it is said that well begun is half done. But if you close in time also, then it is completely done. So we had a time till 6:30 to 8 p.m. and it is 8:05. So we started at 6:05. So I think it's time that we can close it down. And if there are any questions or queries or anything you want to discuss personally, we are just a phone call away.
Thank you, Dr. Naveen, for the wonderful insight you have given. Hello.
Yes, you are audible, Dr. Rajiv.
Audible.
Yes.
So it was a wonderful insight about how and why to become pain physician. So many PGs and residents, they ask about whether it is good to be a pain physician or not, or they want to continue this anesthesia practice. But at the same time, what we advise that if you want to be known in the patients, among the community, among the society, it is always better to go for a pain physician. So the people like Dr. Naveen and so many others who are training the people, training the students as a pain physician, I think this is wonderful thing, and we have started this class as our first academic class of this session. And in between, I have seen that so many of the students, so many of the doctors who are attending this PG class, they decided about that they want to be pain physicians. There is something very good and very positive about this academic class.
Thank you, Dr. Sethi. Yeah, that fulfills the purpose. And yes,
May I add, sir?
Yeah, please, Dr. Sethi.
First of all, I must congratulate Dr. Naveen Malhotra for taking up first class of this new academic session and for a wonderful talk and motivating so many people over here. One thing which I want to add is, I have seen 2-3 examples that anesthesia and pain cannot sail in same boat. They are practicing anesthesia as well as pain. So they are not very successful people, although few people are doing in my city also. But if you are doing pain, then you have to give 100%, as Dr. Naveen said, and the module what he has proposed. Only then you can be a successful pain physician. And I have seen many people, patient is sitting and he says, I'm going for some cesarean section or some other surgery, please wait for some time. And then the patient sometimes don't turn up. That gives a negative feedback for them. So sail in one boat, become an independent pain physician like Naveen and so many people over here. Thank you very much.
Thank you, Dr. Sethi, for those compliments. And yes, one day you have to decide. And I'm very happy today, many of you have decided. And throughout the year, our focus will be there, in addition to other projects, ensuring that many anesthesiologists take pain medicine exclusively as a career. Thank you very much. Next class will be extension of this class by Dr. Shushma Bhatnagar, who shall be talking about cancer pain, palliative medicine, and most importantly, the nitty-gritties, legalities of prescribing opioids by the anesthesiologist. And she will be highlighting that no further training is required by anesthesiologist to prescribe opioids. Thank you very much. Long live ISA, Jai ISA and Jai Hind. Thank you.
Long live ISA.
Long live ISA.
Long live ISA.
Thank you.
Long live ISA. Thank you.
Long live ISA.
With this, we come to an end of our session. Good night, and thank you so much, everyone, for joining us today.